Hello everybody, my name is Olga Żmijewska-Kaczo. I'm the emergency consultant in Royal Cornwall Hospital Trust and ultrasound lead for emergency department. Today's lecture I would like to dedicate to extended focus assessment with sonography for trauma, in short FAST. As we all know, we perform the FAST in emergency department as part of our daily routine, and I think for everyone it will be good if we put our knowledge into practice and review some pathologies. So what was the initial purpose of FAST? FAST's examination was designed for unstable traumatic patient to confirm the possible bleeding into abdominal cavity. However, more we know about FAST, more we know that we can use them not only in traumatic settings, but in all clinical settings when we have unstable patient and we think that they may bleed into abdominal cavity or they may have a free fluid in abdominal cavity or pleural cavities. Performing eFAST, we should follow the pattern, and examination itself shouldn't take more than 15 minutes, especially if we focused on main clinical findings. So what area we have to examine? We have to start from the right upper quadrant, followed by the left upper quadrant. We have to examine the epigastric region, suprapubic region, and also right and left subclavicle space in the midclavicular line. As we said, we're talking about looking at the probe positioning and the probe itself. We used curved linear probe, sometimes called the abdominal probe. In some circumstances, especially when you examine children, you can also use the phase array. So we examine in right upper quadrant, followed by the left upper quadrant, epigastric region, suprapubic region, and left and right subclavicular space. So examining patient in the right upper quadrant, what's normal and how it looks like. So you can see the liver and the diaphragm. Next to the diaphragm is lung, and below the liver you can see the right kidney. So if you expect the free fluid, it will be between the kidney and the liver in so-called Morrison's pouch. And another example, you can see the liver, you can see the dome of the diaphragm and lungs below. You can see the right kidney itself with good differentiation between the core and the cortex. And you also see something we call the spine sign, so you can see the spine there. Next, we're moving to the left upper quadrant, and again we see the spleen, we see the dome of the left diaphragm, we can see the lung and the left kidney. Free fluid will be located in the space between the spleen and the kidney. And again, you can see the spleen and you can see the left kidney. In this case, dome of the diaphragm is not clearly visualized, so you cannot exclude the free fluid in a pleural space. Now we're moving to the epigastric region. So in the epigastric region, you can see the liver. Below the liver, there is a pancreatic head. You can see the IVC and aorta. And in this case, you can see the renal artery. And you can see the vertebra. So the mnemotechnique is to remember that in epigastric region, it looks a little bit like a shouting angry man. And again, epigastric region. So what you can see here, That's the stomach. Below it is the pancreatic head, and you can see the IVC and the aorta, and also the vertebra. So sometimes you can see this picture when the patient eaten right before attending emergency department. So you can see the stomach and the pylorus. Now you can see the same probe position but in a sagittal plane. So you can see the pylorus, you can see the liver in here, you can see the aorta, and you can see the SMA. That's the celiac trunk. Abdomen can contain a lot of pipe-looking structure. So if you're unsure what you're looking at, you can put the Doppler on, and if you can see the trace of the heartbeat, you can be sure that you're looking at aorta. You can also visualize both IVC and aorta from the liver window. So you put the probe in the right upper quadrant space. You can see the liver. Just below the liver you can see the IVC and with the entrance to the right atrium. And below you can see the pulsating aorta. This projection is particularly useful when you have obese patients and you have a difficulty to adjust the depth enough to reach the aorta. Now we are still in epigastric view, and using the epigastric or subxiphoid projection, you can look at the heart itself. So you can see the liver window, so you can see the liver, and next to the liver is always the right heart. So you can see the right ventriculum, tricuspid valve, right atrium, left ventriculum. Here, that's the left atrium, and that's the mitral valve, and you can see the glimpse of the aortic valve itself. And why is it important? Because sometimes when you look at the patient and you're scanning them in epigastric region, you may see this. So you can see the liver in here, you can see large pericardial effusion and heart with slightly collapsed right ventriculum. So this patient was brought as a trauma, and that was the accidental finding that was not related to trauma. His primary reason for collapse was pericardial. Now we're looking at the suprapubic space, and that's normal. So you can see here that would be the bladder, and below is rectum. Now we're twisting the probe with notch looking towards the patient's head, and we acquired the sagittal plan of the suprapubic view. So you can see the bladder in here, and as you can guess, that's the lady, because we can see the womb and the endometrium. So free fluid will be located in between the bladder and the uterus. When we're looking at the lungs itself, we focus on assessing whether we see the lung slide or not. So you can see the muscle layer, that's pleura, and you can see the pleura is sliding nicely. If you can see the pleural slide, so lung slide, you can exclude the pneumothorax. That's particularly important when we're dealing with a patient in a very busy environment and you struggle to see if the patient have equal breath sounds. Now, the few strange things you can find. So on this scan, you can see the right upper quadrant space. You can see the liver, you can see the dome of the diaphragm, and you can see the pleural effusion. On the next scan, you can see the left upper quadrant, so you can see the spleen itself. You can see the kidney, so the left kidney, and you can see the large rim of the free fluid around the spleen. We previously talked about the aorta, so now you can see how the aortic aneurysm looks like. So that's the epigastric view with the large aortic aneurysm measuring 6.5 centimeter. Please make sure you measure from wall to wall. Don't focus on the lumen of the aorta itself, because sometimes it may contain the clotting that will obstruct your correct measurements. This time aortic aneurysm with rupture. So you can see the distended aortic wall with the rupture here. So that's where the blood is leaking. And you can see the cloth in the lumen of the aorta. So just remember, when you're measuring the aortic aneurysm, you have to measure from the wall to other wall, not from the wall to the cloth. On this scan, you can see the right upper quadrant space. So you can see the edge of the liver, you can see the right kidney, and you can see the rim of the fluid around the liver. And now we can find out what's good about the ultrasound scanning. It's because we are not exposing the patient on the radiation. Therefore, you can repeat the scan as much as necessary. And you have the same scan of the same patient, remember on the previous picture, with much larger rim of the free fluid around the liver. So a patient that was rescanned after an hour shows the progression of his bleeding. Now, as I mentioned before, we can use the technique of eFAST scanning, not only assess the potential of the bleeding in abdominal cavity, but also potential of any kind of free fluid in abdominal cavity. So here you can see the suprapubic view, and you can see the free fluid and compressed bowel loops. And again, more on this picture, so you can see the large amount of free fluid. I'm pretty sure this patient had ascites, and you can see the floating bowel loops. It very much looks like a cloud in the sky. And sometimes when you scan the patient, you can come with surprise. So this lady didn't expect that she was pregnant. However, on the scan, you can see the placenta, and you can see a living, looks like healthy baby. When it comes to looking for the free fluid during the early pregnancy and the possible location of the fetus, you can also scan your patient, and in this case you see a very early pregnancy, you can see the placenta, and you can see a little beanie baby waving to us. So this is intrauterine pregnancy, and this patient can be safely discharged home to be managed by the gynecology later. Thank you so much. That will be all about the eFAST and free fluid ultrasound examination. I'm hoping you enjoy your lecture, and if you have any further questions, you can email me or contact me directly on the shop floor.